My name is Peyton Bogert. I am an SCP2608. Today I will be doing the persuasion speech. I am choosing not to use an index card for this presentation. The following is my UFID. At this time, I would please like to ask all 5 of my audience members to wave. Thank you. I have provided my audience member the PowerPoint slide since the contract is a little harsh here. David Jeff, the father of an addict, quoted that addiction remains kept a secret because of overwhelming shame. Yet if society challenges the notion that addicts are morally flawed, we will see that addiction is not a choice. After listening to this video, you will be gifted an insight that addiction is a disease, and you will be compelled to act by supporting legislation that seeks to expand insurance coverage. By listening to this persuasion, you will walk away with knowledge about addiction and will learn about the benefits of expanding insurance coverage. I am an informed instructor on the topic of addiction because I've taken several classes on addiction and I have conducted research on addiction. Today, I'm going to discuss, first, the consequences that arise when we view addiction as a moral failing. Second, the solution of recognizing addiction as a disease and expanding insurance coverage. And finally, together, we will visualize a world in which addicts have access to affordable care. An array of consequences arises when we view addiction as a moral failing. Dr. McCall states that when scientists started studying addictive behaviors in the 1930s, it was assumed that the causes of addiction were self-inflicted. This negative stigma led to restrictions being placed on insurance coverage. Yet addiction affects thousands of individuals. According to statistics from Addiction Center, it is predicted that 700,000 lives have been lost in the mere span of 18 years due to drug addiction. In addition, the NIDA predicts that there is an annual $700 billion financial burden placed on America's economy because of drug overdoses. Addiction inflicts suffering on more than just the addict. Addiction inflicts suffering on humanity. Yet, the suffering can be minimized if we recognize that victims are out of control when it comes to addiction, and if we maximize our insurance coverage. The solution I recommend requires us to first recognize addiction as a disease, and then seek to expand insurance coverage. Researchers like Dr. McLennan and Dr. Lewis have found that addiction shows similar heritability rates to other insured diseases like hypertension and diabetes. A figure explaining their data is displayed on your slide. These researchers help believe that if we classify addiction as a disease, insurances will be prompted to cover it. Experts like Dr. Gardner have found that the greatest contributor to treatment completion and rehab was the exception of Medicare payments. Dr. Gardner proved that treatments are more effective when they are insured. Some critics may argue that addiction should not be insured because choosing to take a drug is a personal choice. However, personal choice like diet and exercise often contribute to other insured diseases like hypertension and diabetes. And when we take into account personal choice for other insured diseases, the same mindset must be granted for addiction. By recognizing addiction as a disease and expanding treatment options, we can begin to imagine a world in which addicts have access to proper care. Doing nothing is not an option. If we do not initiate change, it is predicted by the NIH that we will lose 70,000 lives a year. In 20 years, this will amount to 1.4 million deaths. Yet measures can be taken to prevent this. Imagine if Congress continues to pass bills like the Addiction Equity Act, which mandates a minimum level of insurance coverage. Imagine if we as a society continue to support publicly funded in-state rehab programs and nonprofit rehab programs like the Salvation Army. Imagine if these measures just simply slowed the death toll. On this slide, you can see a few of the lives that have been lost over the course of a year from addiction. As we can see, with addiction, anyone can be a victim. From surgeons to teenagers, no one is safe. And so I ask you, if it was you, or worse, if it was your child, how would you want society to see and treat addiction? Let us leave here today working together to see the world you just envisioned become reality. Let us believe that addiction is a disease. Let us work together. Let us vote for policies that will expand insurance coverage. The battle is not lost. Treatment options can be improved if we first recognize the negative stigma that clouds addiction. We can then offer a solution by expanding insurance coverage. With this simple solution, imagine the lives that would be saved. I am personally moved by this vision because it would be an honor to live in a world in which addicts can receive care without shame. William C. Morter, a father of an addict, once quoted that recovery is about the process of dealing with the hole in the soul. If we unite at the front, we can patch in the hole that cripples the soul of humanity. Thank you. At this time, I'm open for any questions.
Yes, are there any certain characteristics that make a person more or less likely to become an addict?
Yeah, there are several factors that might contribute to your risk of becoming an addict. I've mentioned earlier, hereditability is often a factor that plays into the role of whether or not you are predisposed to addiction. Your drug of choice may also make you become an addict quicker. Meth is typically more addictive than marijuana. And then lastly, your time of usage often plays a role in whether or not you become addicted to a substance. If you start at a younger age because your brain is still developing, you are more at risk of developing an addiction.
Are there different ways of treating different addictions?
I'm sorry, can you repeat your question?
Are there different ways of treating like different addictions?
Yes. So there are different treatment options available for each drug. Some drugs actually have more treatment options because there's been more research done on them. There's actually not a drug that can minimize the neurotoxicity of meth developed. But in addition to alcohol, opioid, or heroin, there are actually several options in prescription drugs that you're allowed to take to help manage the symptoms of physical tolerance and withdrawal.
Are there other obstacles that prevent treatment options?
Yeah, there are several obstacles that prevent the treatment option for addiction. The main problem with treatment options for addiction would be that there's been a lack of research, primarily due to lack of government funding. In addition, there is racial inequality associated with treatment options for addiction, especially among Mexican Americans. It has been found that they have like the lowest rate of treatment completion. They believe that the cause of this is because the most primary accepted form of payment for Mexican Americans in terms of treatment rehabilitation is Medicare payment, and most rehab programs do not have accept Medicare as a form of payment.
Is it possible to recover even after a relapse?
Yes, that's a very important question. And it's also extremely important to understand that scientists often state that rehab is part of the recovery process. So even if you relapse after a rehab program, there is still a chance of recovery because sometimes it teaches the addicts that they actually have control over their drug usage, and that a relapse does not mean that recovery is impossible in the future. Are there any other questions? All right, thank you so much for your time today. I hope you guys learned something. All right, bye.